Good morning. So today we will be studying the human menstrual cycle. In the human menstrual cycle, it consists of 28 days. So the most important and critical step of the human menstrual cycle in females is the step of ovulation, which happens on about the 14th day of human menstrual cycle. So now there are four principal hormones governing the human menstrual cycle: the FSH, the LH, the estrogen, and the progesterone. Now you have to remember that the FSH and LH hormones are released by the pituitary gland, while the estrogen and progesterone hormones are released by the ovary. These are very critical things of information you have to remember. So now what happens in the human menstrual cycle is that during the first 7 days, in this chart you can see better that during the first 7 days, the role of FSH is predominant, and it secretes follicle stimulating hormone, which helps increase the growth of the follicles. Now, after the 7 days, up till the day 14, the role of LH, luteinizing hormone, is increased. The LH, the luteinizing hormone, helps to carry out the process of ovulation, and the maximum chance of ovulation is on the day 14th. Now, this is a very important question that they asked on which day ovulation occurs, and also that which is the day when there is maximum chance of fertilization. So you need to remember that the human sperm can only survive in the vagina for about 2 to 3 days. So the maximum chances of fertilization are before the 2 to 3 days before or 2 to 3 days after ovulation, as represented by this bracket, which demonstrates the ovulation. Now, well, just for the concepts, you need to know that when a human female reaches the state of menopause, which is about 50 years of age, she stops ovulating, and thus she cannot give birth. Now, as I told you before, that the human menstrual cycle consists of 28 days. However, these days vary. It does not have to be a necessary exact 28 days. It can extend up to 42 days in extreme cases, or can be lesser. So, the factors which affect the human menstrual cycle are stress and diet. So now, what is why I discuss the role of the FSH, the follicle stimulating hormone, that it helps in the growth of the follicles, and it helps the release of eggs from the ovary. The LH, it works synergistically with the FSH hormone and helps to ripen the egg. And you now need to know that each hormone, which when given in the order, like FSH, increased amounts of FSH give rise to help to give rise to increased amounts of LH, and similar is to the case with estrogen. So LH works with FSH and helps to ripen these eggs, and then for following helps to give rise to increased amounts of estrogen. Now, estrogen helps to create the spongy lining, and you need to remember that the spongy lining is thickened by the estrogen and the progesterone. The progesterone is the extremely important hormone for the implantation of the ovary on the of the basically the egg on the uterus. So the progesterone is responsible to maintain the spongy lining of the uterus throughout the pregnancy. If the levels of progesterone decreases, it leads to abortion. This is also the reason why in many of the contraceptives are filled with estrogen and progesterone. So because estrogen and progesterone, you need to remember that just like I said, that FSH give rise to more amounts of LH, and LH similarly helps to give rise to more amounts of estrogen. However, you need to remember that progesterone and FSH have a feedback inhibition on each other. So the feedback inhibition process, which I studied in the chapter of homeostasis. So if the progesterone amount is increased, the FSH amount is decreased. So as the oral contraceptives contain an increased amount of progesterone, the amount of FSH is decreased. And since the amount of FSH is decreased, there isn't even the release of eggs to begin with. So the process of the entire menstrual cycle cannot even continue, and there isn't ovulation. So in hormonal oral contraceptive pills, you need to remember that each combinations of estrogen and progesterone are used. So this is all the information we've just talked about in the lecture previously. Now, this is an extremely important question, which is the functions of the amniotic fluid. So as you know that the human, when the human is in the womb of the mother, it is known as the fetus. So the fetus has to be protected from any physical damage. So the amniotic fluid basically support helps to support the fetus and acts as a cushion for the fetus, so it does not have any physical damage. Also, the fetus can get some restricted movement. It can move without damaging the mother. Now, the nutrition and excretion of the fetus acts through this special structure called the placenta. Now, as the fetus also have the same requirements as normal human beings, it requires plentiful amounts of glucose, oxygen, amino acids, and vitamins. So all these go from diffusion via the bloodstream from the mother to the fetus, while the excretion involves the removal of the nitrogenous waste products and urea and creatinine and carbon dioxide which the fetus respires. Now, you know that when after delivery, the placenta is removed along as well as the umbilical cord, which is cut. Now, during the human pregnancy, you need to know that just for your information that there are only two veins in the human body which carry oxygenated blood. One which we studied during the process of respiration, which was the pulmonary vein, and the second most important vein, which is the umbilical vein. The umbilical vein is also oxygenated. This is repeatedly asked in the examinations that the umbilical vein carries oxygen. So, as we know that the fetus is supplied nutrition by the placenta, obviously the pregnant woman needs way more dietary requirements than normal human beings. So she needs a plentiful amount of proteins, carbohydrates, vitamins, and iron, as she doesn't only have to feed herself but the baby as well. Now we will discuss the importance of breastfeeding. Of all these points, the most important basically value or the most important thing of breastfeeding is that in milk of the mother contains antibodies. This is not available in the milk which is present in cows. So the milk from breastfeeding contains antibodies which help protect the fetus from all sorts of microorganisms. So you need to remember that the fetus does not have a good immune system on its own, and it will only develop after a passage of a few years. Now, apart from the antibodies, you need to remember all these 3 to 4 other advantages as well. However, they're pretty simple. That obviously the milk from breastfeeding is cheap, it's readily available, and it contains all the nutrients in the correct proportions, and there's no expiry date, unlike the milk which has to be after pasteurization from the cows is given. So now we talked about birth control pills, how estrogen and progesterone are given in contraception. However, there are several other methods as well. So you need to just have a brief understanding of them. There is a natural rhythm method in which couples basically they tend to don't engage in sexual intercourse by the day 14 or in the days in which ovulation or fertilization have a high chance. This is known as the natural rhythm method. However, since the menstrual cycle, like we talked earlier, that it varies in many females, it is very unsuccessful. So the second is the chemical method in which is used to kill sperm before intercourse. However, similarly, it also has a high rate of failure. Now, thirdly, the mechanical method, in which is the most used condom, which has about 99% efficacy. It is used to just catch the sperm before ejaculation, and it is 99% effective. Similarly, other mechanical methods include inserting an intrauterine device as a contraceptive inside the uterus. This prevents the implantation from taking place. And finally, the hormonal method, which we talked previously above as well. However, the hormonal method is contraindicated in elderly women as it can lead to a variety of side effects such as hirsutism, such as acne, such as breast tenderness, such as deep venous thrombosis, and many other side effects. So it is the least preferred method. The final method, which has about 100% efficacy since it is the surgical method called vasectomy. You need to know the name vasectomy in males and in females. So in males, the sperm ducts are cut and they are ligated. The surgical method is reversible. Now we will be studying this sexually transmitted disease. The number one sexually transmitted disease is syphilis. Syphilis is also known as Treponema pallidum, as it is a bacterial disease. The main signs and symptoms of basically syphilis are a painless canker on the penis, as well as sores on the penis. There is obviously a raised temperature, since in every infection there is raised temperature, there's headache, there's rash. Along with the other side effects, there's destruction of the organs, there's various organ systems of the humans, such as the CNS, which involves the brain, the skeleton. And for the treatment, we use antibiotics, as we studied in the previous chapter, that to eradicate bacterial diseases, we use antibiotics. So what is the protection, or what is the treatment for syphilis apart from antibiotics? You should always use a condom, and when people should stick to one sexual partner. So the second most important disease is AIDS or HIV. So you need to understand that what is AIDS. AIDS is basically it happens in immunocompromised people, that its main passages of transfer are basically through sexual intercourse from one partner to the other. It can be transmitted from mother to the child during the process of birth, and mainly through the passage through the vaginal canal. And the most frequent is through blood transfusion in syringes, which are used again and again, and are contaminated with blood from people of AIDS. So AIDS basically develops, HIV develops into AIDS when the T lymphocyte count of the patient is below 200 lymphocytes. So AIDS develops in immunocompromised people, and it helps and it affects the various organ systems of the person, such as the CNS, such as the CVS, the kidneys, and a person can catch any of the disease which a normal human being has a very low risk of catching due to a good immune system. So, and the lifespan of people from AIDS is significantly reduced by about 10 to 20 years. So, what should we do? We should just educate the public and never ever share needles. Also, there should be better sexual hygiene used. We should use condoms, and there should be basically education about the disease. Thank you. I will now join you in the next chapter.